friends, this is Dr. Mandavi and I'm Senior Consultant at Indira IVF Noida. As you guys know, we are fighting a pandemic. I hope you all are safe. Please wear masks when you go out and don't go out unnecessarily when it is not needed. And please maintain a distance and always sanitize your hands when you come back from outside. So today we are going to talk about a very important topic, which is PCOD, which means Polycystic Ovary Disease. It is a very prevalent disease, especially among the youth. In youths, almost 5 to 10% of the reproductive age female are suffering from this. That means 1 in every 10 female is suffering from PCOD. So you need to understand what exactly it is, what causes it, what are the signs and symptoms, and what treatment has to be given for this. And it's a myth that people with PCOD cannot conceive because they can very well conceive. Now we will see what are the causes of PCOD. What causes PCOD? There are two very important factors which can cause PCOD. First is the environmental cause, second is the genetic cause. So in environmental cause, basically it is the sedentary lifestyle which people are nowadays following. Their lack of exercise, lot of stress people are having, and they are not having a very balanced diet. Means they are having all type of junk foods, which is the main and the root cause of PCOD. Secondly, we are sometimes finding it to be genetic, like your sisters or cousins who are also suffering from the same disease. Now let's see what exactly causes PCOD. PCOD is caused by insulin resistance in the body. If the insulin is resistant in your body, it will lead to increase in the male hormones in the body, which is also known as hyperandrogenism. And because of this, you will have symptoms like there will be hirsutism, that is excess of hair growth, acne, or anovulatory cycles, meaning you will have irregular periods. So now let's go what exact symptoms you will have in PCOD. In PCOD, you will have irregular menstrual cycle, means you can have very less flow in your menstrual cycle, or sometimes the flow is very heavy, sometimes the duration is quite long, or sometimes you have to take medicines to get your periods. Then there is hirsutism, means excess of hair growth on your body, face, or there can be acne, there can be infertility related to this, there can be miscarriages, there can be depressions and anxieties because of this. So these are the major signs and symptoms of PCOD which you don't have to ignore. So how do we diagnose it as a PCOD? For diagnosis of PCOD, we at least need 2 criteria out of the 3. Firstly, you should have irregular periods. Secondly, there should be hyperandrogenism, means excess of male hormones in the body. And thirdly, on ultrasound, we can see there is polycystic ovaries. So what does exactly polycystic ovary means? In polycystic ovary, the volume of the ovary is more than 10 cc. There are a lot of small polycysts in the ovary, and not that one single oocytes will increase in size and lead to menses. In fact, you will have irregular menses or anovulatory cycles. Now let's see what are complications you can have because of PCOD. In PCOD, you can have diabetes mellitus. 1 in every 10 female is having diabetes mellitus because of untreated PCOD. Then you can have increased BP, that is high blood pressure. You can have heart diseases because of that. You can have irregular bleedings, anxiety, depressions, and there are cases also of endometrial cancer which can happen because of this. Endometrial cancer can happen if the person is having less than 2 or 3 periods in a year. So let's see how can it be managed? What are the management we can do for PCOD? First and the foremost and the most important is you have to have a lifestyle modification. In lifestyle modification, you need to have a balanced diet. You're not supposed to have junk foods or packaged foods. You should have a very healthy vegetables and fruits and all the seasonal fruits and vegetables which are available. And the second and the most important part is you should always exercise to lose weight. At least 150 minutes of exercise in a week is very much required for it, which means at least 20 to 30 minutes in a day. And you should be very consistent with your exercise. This can lead to loss of weight. And even if 5% of weight is lost, it can have a huge change in your body, and it can also help in improving PCOD. Secondly, we give treatment for your symptoms also. Like when there's a menstrual irregularities, we will give you oral contraceptive pills. When there's acne and hirsutism, we will also give you oral contraceptive pills. If it is not managed by that, then we'll give you anti-androgenics for the same. And suppose if a patient is suffering from infertility, then there are various treatment regimes which they can follow. First and the foremost is we can go for ovulation induction, in which clomiphene citrate and letrozole is used for treatment. You can try this for 3 to 6 cycles. If it does not happen, if you don't get pregnant, you can further go for other treatment modules. Like you can go for ovarian drilling. After that, even if that does not work, we can always go for in vitro fertility, as it has proven to be the best and the easiest way of getting the treatment. So I hope you have understood what exactly PCOD is and what can be done to prevent it, and that people with PCOD does not get pregnant is a big myth. And still, if you have some doubts which is not clear, you can always contact us on the number which is displayed below, so that we can further clear your doubts. Thank you.